Hi, I'm David Williams. I'm a Bureau Chief at HSJ. We've held a roundtable discussion today with Siemens Healthineers to discuss the need to stimulate innovation in the NHS at a time when we're also trying to stamp out unwarranted variation. We've convened a panel from across the NHS to discuss that important topic. Some of the things that have come out of today's discussion are that people have different experiences of whether the financial squeeze is acting as a spur to innovation or is stifling new ideas. We've also found that some people don't think that those 2 points, stimulating innovation and stamping out variation, are necessarily mutually exclusive.
How can we prioritise people's creativity, their time, their effort to really solve the big problems that we're grappling with in the healthcare system that no one has solved? So actually, how do you support an ageing population with dementia? What does that long-term integrated pathway look like between social care and health services that actually supports families and carers? There are these big issues that we don't have solutions to, and I don't believe we do have the right solutions to. And so how can we focus some of our energy on the areas that really need innovation, rather than just blanketly supporting innovation across all services and across all staff? I think we need to focus, and I think we need to see prioritisation given the context of our healthcare system.
From my perspective, having worked in the NHS innovation space for the last 13 years, you need actually both things. You need to be able to say, these are the priority areas, what can you, what are the solutions that we can generate for these? And then the other side is actually the serendipity, the things that just come out and actually, well, this will actually fit into one of our priority areas, or actually it's something that we're going to face as a big issue in 3 to 5 years' time and we need to develop it now. So I know it's counterintuitive, but I think you need to do both at the same time.
Importance of having the infrastructure to help people innovate, so that actually any healthcare professional can just say, wouldn't it be good if? And they don't necessarily need to have the solution, but you have a mechanism for starting to look at that and helping people to make that a reality.
One of the things that we can start doing in the NHS and healthcare systems in general is to use this idea of unwarranted variation as a means to encourage healthcare professionals to innovate. The most important theme that emerged from today's roundtable for me is probably the risk-averse nature in the NHS, in the English NHS. And I think that leads to demoralization in the workforce, and I think it also leads to a lack of innovation. It decreases the autonomy of the healthcare professionals in the system to actually realize and exploit their creativity and their potential.